When the SA node depolarizes and it fires, PQRST complex comes, that is known as sinus rhythm. Any abnormality in the function of the SA node is sick sinus syndrome. Maybe a sinus pause, arrest, arrhythmia, exit block, sinus tachycardia, sinus bradycardia, or sinus tachybradyarrhythmia. In sinus arrhythmia, the rhythm is irregular. And number 2, QRS complex is less than 0.12 seconds. So in sinus arrhythmia, the rhythm is irregular and a QRS complex is less than 0.12 seconds. When there is sinus syndrome or sinus arrest, it is a pause. See that on this ECG on the left, rate is normal, then there is a pause, and then there is tachycardia. Similarly, in the lower one, rate is normal, and then there is a pause, and then high rate. SA node exit blocks, the first degree exit block, there is prolongation of conduction from the SA node. SA node impulse is merely slowed, but the ECG is normal in that case. There is a problem in the SA node impulse to get out of the perinodal tissue into the surrounding atrial tissues. This cannot be recorded because the external leads do not record the SA node electrical activity, so the ECG is normal. The second degree SA node block, two types, type 1 and type 2. In a type 1, there is progressive shortening of the PP interval followed by a pause. And what happens in type 2? There is no shortening in the PP interval, but there is a sudden pause. And in type 3, there is no P wave visible. At what age the SA node dysfunction is common? SA node dysfunction is more common in the 5th and 6th decade and is usually asymptomatic. And what age the AV node block occurs? The AV node block is more common in young patients. And why is it due to? It's due to high vagal tone as occur in athletes. So this SA node dysfunction is usually asymptomatic and becomes evident on ECG. What are the clinical features of the SA node dysfunction? Hypotension, syncope, and lightheadedness. What is the cause of sick sinus syndrome? There are increased fibrous tissue and the sinus pause is of more than 3 seconds. Why? Because usually the athletes have a sinus pause of up to 3 seconds. What are the causes of sinus node dysfunction? Two causes, extrinsic and intrinsic. Amongst the extrinsic causes are the drugs, antiarrhythmic, the class 1 and 2, beta blockers, calcium channel blocker, and digoxin. Drugs used in psychiatric patients, phenothiazine, amitriptyline, lithium, and methadone. Which antacid causes sinus node dysfunction? Cimetidine. Other causes are hypoxia, hypothermia, and hypothyroidism. Increased vagal tone also causes sinus node dysfunction. Important to remember is the increase in intracranial pressure and also endotracheal tube suction cause sinus node dysfunction. So what is the cause of intrinsic defect? There is fibrosis and degenerative changes in the SA node. Increase vagal activity. Number 3, coronary artery disease, myocardial infarction. Which type of myocardial infarction causes SA node dysfunction? It is the inferior myocardial infarction. Then carditis, radiation therapy, myotonic dystrophy, and Friedreich ataxia.